My name's Dan Leffler. I'm a gastroenterologist, an associate professor in gastroenterology at Harvard Medical School in Bethesda Deaconess in Boston, and a senior medical director at Takeda Pharmaceuticals, where I am the clinical development lead for their celiac disease program. So I've been asked to talk to you a little bit today about endpoints in celiac disease trials. And I know that may sound like a little bit of a dry topic, but it's actually really, really critical. And so I hope you'll bear with me, and I'll tell you a little bit about what all this means. First off, though, I do want to say that the most important thing that I'm going to say during any of these talks, and I say it all the time, is that we need you to participate in trials. We cannot make progress in celiac disease without the help of the celiac community, without continued efforts of people volunteering their time to participate in our clinical trials. So I thought that a good way to start this talk was really to talk about what you should ask about being in a trial if you're considering that. And again, I hope you will consider being in a trial. And the first thing you're going to want to ask is, what is the intervention, right? What are they doing? Is it a diet tool? Is it a new technology? Is it a new medication? All of these are clinical trials that we participate in. We think a lot when we say clinical trials, we're talking just about new drug therapies, which again, is an important part of what we do, but there's lots of types of clinical trials, lots of types of clinical research, all of which will have an intervention. So that's the first question you should ask when you're participating in trials. What's this intervention? Second question is, who is it for? Is it right for you? Are you the type of person they're looking for? Third is the risks. What risks could this have? Is there a risk to privacy? Is there a risk of a new medication? All of those things you're going to want to know if you're thinking about participating in a trial. The next one is the outcomes. And this is what ties in probably most closely with the topic of my talk, which is endpoints. But it's, what are the outcomes? What are they actually looking for in a trial? Is it primarily safety? Is it some form of efficacy? What does that efficacy look like? Is it a change in behavior? Is it a change in how you feel? Is it a change in a blood test? All of those are important because they should be relevant to you. If you're going to participate in a trial, no matter what it is, it's really important that it means something to you. And the best way you'll know that it means something to you is what those endpoints are and what those outcomes are. Do they feel like they are, again, something that you can relate to? And finally, with any trial, there's going to be something that you're asked to do, whether it's fill out a survey or take a medication for a year. Any of these are on the list. It could be endoscopies, it could be a lot of different options. So what tasks and work, and does that actually fit into your life and routine right now? So those are the things you really want to think about when you're thinking about participating in a trial. And all of that is really dependent on the endpoints the study is going to look at. And so that's why really the endpoints are so critical, not just for how you design a trial, but for whether the trial is actually right for you, because it's the endpoints that define each of those things. They define what's done and when it's done, who it's done with, what the risks are and how those are evaluated, what the study outcomes are, and again, how they're measured in the types of tasks and work you do. So that's a long way of saying that the idea of endpoints is very, very broad. But it is the first thing we think about as scientists when we're designing a trial. We want to know what it is we're trying to do, what it is we're trying to show or prove or change in some way or another, because that really defines everything else we do and how we design the trial. It defines what kind of tests we do, how long the trial is, what kind of monitoring we do in the trial. So each trial will have some combination in general of safety endpoints and efficacy endpoints. So is what they're doing, what we're studying, safe? Sometimes if it's just a survey study or something like that, there'll be very little in the way of a safety study. But even in interventions of new dietary technologies, there should be a safety arm. I think one of the better examples of this in recent celiac disease history is the studies that were looking at the portable gluten sensors for food, whereas they looked at the efficacy, e.g., could it actually help prevent gluten exposures that were symptomatic? But they also looked at something that was a safety endpoint, is did this cause hypervigilance? Did this make people so concerned and anxious that the avoidance of gluten was offset by the psychological burden of using the tool? So that's a good example of something that you wouldn't necessarily think of a safety endpoint, but there still was, because it was a well-designed trial that, again, will almost always have safety and efficacy endpoints. And so that's, one of the points of telling that is to say that just because a study is studying safety endpoints doesn't mean it has a safety issue that you need to be particularly concerned about. This is just part of doing a good job being a diligent scientist, is that you're looking at all ends of the spectrum, because there can be unintended consequences of almost any type of intervention. So next, let's talk about the efficacy endpoints, because this is really where I think a lot of attention is rightly focused. And it's an area that's really unsettled in celiac disease. And that's, the bad of that is that we have a lot of work to do, and we don't have a set way of doing clinical trials. And so there's a lot of evolution right now. But the exciting part of that is there's a lot of evolution right now in celiac disease and what endpoints we use in clinical trials. So the big categories, as I think about them, are biomarkers and patient-reported outcomes. So biomarkers can be anything from biopsies of your small intestine to specific blood tests like celiac serologies, or looking for specific immune cells that are active in celiac disease and seeing if we can change them. And those are really important. I mean, we know as clinicians and scientists, and as patients, that having a healthy intestine is a really critical goal in celiac disease. So of course we want to measure that in trials, but we want to do that in a way that is minimally burdensome. So we don't want, people doing endoscopies left and right is obviously a challenge. But there's also things that are imperfect about that technology as well. We only are seeing a very small part of the small intestine. And there's a lot of artifact that can come in the way you read the biopsies. It's very, very challenging to do very good reads for trials of celiac disease biopsies, even though we've been doing it for a long time. So that's an example of biomarkers. I don't think there's any single perfect biomarker. I think we are fortunate that there's a lot of different biomarkers in celiac disease that measure different things about celiac disease, whether it's a TTG that measures the antibodies your body produces when people are exposed chronically to gluten, whether it's cytokines, inflammatory chemicals that are found in the blood after a gluten exposure, or whether, again, it's the intestinal damage that we see with more chronic gluten exposure, but is, again, slow to come on and slow to heal. So there are lots of different biomarkers. Often studies will assess at least one, if not more than one. But the type of biomarkers will really depend on the type of intervention. Again, going back to what we're trying to do, what we're actually studying. The other side of this is patient-reported outcomes, or patient-centered outcomes, as they're sometimes called. And these are surveys, to be simple about it. These are things like celiac disease symptom diaries, for instance. And these can be done most commonly these days on your phone or on a tablet device, but occasionally it can be dial-in or paper surveys. And they're going to ask you how you feel. So on a daily basis. And what symptoms they're asking about can depend on the type of the study. Some studies will be focused on the neurologic manifestations of celiac disease, so they might have more questions about headaches and fatigue and brain fog. Some questions are more focused on gastrointestinal symptoms, so they may have questions about nausea and vomiting, abdominal pain and bloating. And so all of these are really important. But obviously, there's a lot more to life with celiac disease than symptoms. And so another big part of the patient-reported outcomes are things like quality of life, social function. And these are another set of outcomes that we look at and endpoints that we can look at in certain types of clinical trials. Beyond just making someone feel better who might be having ongoing symptoms, do we actually make them live better? Are they able to do more in their life and be less burdened by a disease? And this is really a high bar. Obviously, it's actually not one of the things that is typically studied in a lot of other disorders. They really focus on, on more disease endpoints. Ulcerative colitis, if you're familiar, is a really good example, where really the studies predominantly look at inflammation in the colon and symptoms related to that. But the whole quality of life thing is a lot harder. In celiac disease, I think because there's such a high burden of just treatment with the diet for many patients, looking at quality of life and looking at the impact of therapy on the overall life experience is going to be really critical. And this is another big group of endpoints. So just to summarize, endpoints and outcomes in celiac disease trials or any clinical research is really critical. And it's important for you to know when you participate in research, what those endpoints are. And that's something you should feel comfortable asking any investigator about. Like, what are the outcomes in this study? What are we going to learn about celiac disease from this study? And then that should really help guide your interest in participating. So I hope that was a helpful, quick overview and introduction to celiac disease outcomes and endpoints in clinical trials. Thank you for your time and attention, and I look forward to answering any questions you may have.